Question 1. What is the most appropriate initial action when a nurse discovers a patient has fallen in their hospital room? A. Notify the healthcare provider. B. Assess the patient for injuries. C. Document the incident in the chart. D. Call the patient's family. Answer: B. Assess the patient for injuries. Rationale: the priority is to assess the patient for any injuries to determine the need for immediate intervention. Notifying the provider and documentation are essential, but only after ensuring the patient's immediate safety. Calling family is not the first priority. Question 2. Which intervention best prevents the development of pressure ulcers in immobile patients? A. Use of donut cushions. B. Massage bony prominences every shift. C. Reposition the patient every 2 hours. D. Apply heat to pressure points. Answer: C. Reposition the patient every 2 hours. Rationale: frequent repositioning relieves pressure and improves circulation, which helps prevent pressure ulcers. Donut cushions can cause uneven pressure, massages may cause tissue damage, and heat can worsen skin breakdown. Question 3. A nurse prepares to assist a patient with ambulation after surgery. What is the nurse's priority before initiating the activity? A. Offer the patient a warm blanket. B. Review the patient's medication list. C. Assess the patient's vital signs and orthostatic tolerance. D. Encourage the patient to walk independently. Answer: C. Assess the patient's vital signs and orthostatic tolerance. Rationale: assessing vital signs ensures the patient can tolerate the activity safely. Reviewing medications is important but not the immediate priority. A warm blanket is comfort-focused, and encouraging independence is premature without safety checks. Question 4. What is the primary purpose of performing hand hygiene before and after patient care? A. To comply with hospital policy. B. To avoid staining the uniform. C. To reduce the spread of infection. D. To maintain skin moisture. Answer: C. To reduce the spread of infection. Rationale: hand hygiene is the most effective way to prevent the transmission of microorganisms between patients and caregivers. The other options may be partially true, but do not address the primary goal. Question 5. A nurse finds an unlabeled medication at the patient's bedside. What should be the nurse's immediate action? A. Administer it after confirming with the patient. B. Discard the medication. C. Report the finding and follow facility protocol. D. Save it for the next dose. Answer: C. Report the finding and follow facility protocol. Rationale: an unlabeled medication is a patient safety concern and must be reported per facility policy. Discarding or administering it without proper verification can result in harm or legal consequences. Question 6. When documenting care, what action best supports legal and ethical standards in nursing practice? A. Use vague terms to simplify notes. B. Chart interventions before they are performed. C. Document facts and observe behaviors. D. Use abbreviations to save time. Answer: C. Document facts and observe behaviors. Rationale: legal and ethical documentation requires objective, factual, and timely entries. Pre-charting, vagueness, or unclear abbreviations compromise patient safety and legal integrity. Question 7. A nurse is caring for a patient with dysphagia. What action reduces the risk of aspiration? A. Position the patient in semi-Fowlers during feeding. B. Allow the patient to drink water quickly. C. Place the patient in high Fowler's position during meals. D. Suction the airway after feeding. Answer: C. Place the patient in high Fowler's position during meals. Rationale: an upright position during meals promotes safe swallowing and reduces aspiration risk. Semi-Fowlers is not sufficient. Rapid drinking and post-meal suctioning do not prevent aspiration effectively. Question 8. What is the nurse's priority action when a patient starts choking during a meal? A. Call the healthcare provider. B. Begin chest compressions. C. Encourage the patient to cough forcefully. D. Offer water to clear the throat. Answer: C. Encourage the patient to cough forcefully. Rationale: if the patient is still responsive and able to cough, this is the safest first approach. If ineffective, further interventions, like the Heimlich maneuver, may be needed. Water may worsen choking. Question 9. What action demonstrates culturally competent care during a patient assessment? A. Assume the patient understands medical terms. B. Avoid asking about religious preferences. C. Use a medical interpreter when needed. D. Provide the same education to all patients. Answer: C. Use a medical interpreter when needed. Rationale: using an interpreter promotes accurate communication and respectful, individualized care. The other actions disregard cultural and linguistic needs. Question 10. A nurse is preparing to insert an indwelling urinary catheter. Which action is most critical to prevent infection? A. Lubricate the catheter tip. B. Maintain a sterile field during the procedure. C. Inflate the balloon after insertion. D. Position the patient comfortably. Answer: B. Maintain a sterile field during the procedure. Rationale: aseptic technique is essential to reduce the risk of catheter-associated urinary tract infections. Lubrication and comfort are important, but do not address infection prevention. Question 11. When providing oral care to an unconscious patient, which is the safest nursing intervention? A. Place the patient in supine position. B. Use a toothbrush with toothpaste. C. Position the patient in side-lying position. D. Suction only if the patient coughs. Answer: C. Position the patient in side-lying position. Rationale: side-lying helps prevent aspiration. Supine increases the risk. Suctioning should be proactive, and toothbrushes can pose aspiration risks if not done properly. Question 12. Which task is appropriate for the nurse to delegate to a UAP, unlicensed assistive personnel? A. Assessing skin turgor. B. Teaching a patient how to use a walker. C. Ambulating a stable postoperative patient. D. Evaluating intake and output trends. Answer: C. Ambulating a stable postoperative patient. Rationale: delegation must match the UAP scope. Stable ambulation is appropriate, while assessment, teaching, and evaluation require nursing judgment. Question 13. What is the nurse's best response when a patient refuses a scheduled medication? A. Administer the medication anyway. B. Notify the provider without explanation. C. Explain the purpose and document the refusal. D. Hide the medication in the patient's food. Answer: C. Explain the purpose and document the refusal. Rationale: nurses must respect autonomy, educate the patient, and document. Forcing or disguising medication violates ethical standards. Question 14. Which strategy promotes safe patient identification before medication administration? A. Ask the patient their name only. B. Verify name and date of birth using two identifiers. C. Use room number as identification. D. Rely on facial recognition. Answer: B. Verify name and date of birth using two identifiers. Rationale: two identifiers reduce errors and meet safety protocols. Room number and recognition are unreliable. Question 15. What is the correct nursing action when encountering a blood spill on the floor? A. Ignore it and inform housekeeping. B. Use alcohol wipes to clean it. C. Don PPE and use appropriate disinfectant. D. Mop the area with plain water. Answer: C. Don PPE and use appropriate disinfectant. Rationale: blood spills are biohazards. PP and hospital-grade disinfectants prevent infection spread. Plain water and alcohol wipes are ineffective. Question 16. A nurse is caring for a patient with a nasogastric NG tube. Which assessment indicates proper placement? A. Absence of bowel sounds. B. Green aspirate with pH of 4. C. Patient complains of throat pain. D. Inability to talk. Answer. B. Green aspirate with pH of 4. Rationale. Gastric contents are typically green with low pH. Absence of bowel sounds or discomfort doesn't confirm placement. Question 17. A patient reports dizziness when standing up. What is the nurse's immediate action? A. Call for assistance. B. Help the patient sit or lie down. C. Document the finding. D. Encourage walking to improve tolerance. Answer. B. Help the patient sit or lie down. Rationale. Preventing a fall is the priority. Documentation and walking are not immediate actions. Question 18. What is the purpose of a nursing care plan? A. To schedule physician rounds. B. To ensure billing accuracy. C. To guide individualized patient care. D. To maintain hospital protocol. Answer. C. To guide individualized patient care. Rationale. A care plan is a nursing tool to plan, implement, and evaluate personalized interventions. It is not used for billing or administrative duties. Question 19. Which technique best reduces the spread of infection during a sterile dressing change? A. Use clean gloves. B. Work quickly to limit exposure. C. Maintain sterile field integrity. D. Only touch the outer dressing. Answer. C. Maintain sterile field integrity. Rationale. A sterile field is essential for infection control. Clean gloves are insufficient, and speed without precision risks contamination. Question 20. A nurse must bathe a confused elderly patient. What is the safest approach? A. Leave the patient alone with supplies. B. Use cold water to reduce agitation. C. Explain steps clearly and provide supervision. D. Bathe quickly to avoid distress. Answer. C. Explain steps clearly and provide supervision. Rationale. Clear communication and supervision support safety and reduce anxiety. Leaving the patient alone or rushing care is unsafe. Question 21. What is the nurse's priority when caring for a patient receiving oxygen therapy via nasal cannula? A. Tightly secure the tubing around the ears. B. Encourage deep breathing every hour. C. Assess the skin integrity around the nares and ears. D. Increase the flow rate if the patient appears short of breath. Answer. C. Assess the skin integrity around the nares and ears. Rationale. Oxygen tubing can cause skin breakdown. Assessing the skin helps prevent pressure injuries. Adjusting flow without an order can be unsafe. Question 22. Which is the best nursing action to prevent falls in an elderly patient at night? A. Turn off all lights for better sleep. B. Offer a bedpan every 6 hours. C. Place the call light and personal items within reach. D. Keep all side rails up at all times. Answer. C. Place the call light and personal items within reach. Rationale. Ensuring easy access to items reduces the risk of unassisted ambulation. Full side rails may increase fall risk in confused patients. Question 23. A nurse prepares to transfer a patient from bed to chair. What is the safest technique? A. Pull the patient by the arms. B. Use a gait belt during the transfer. C. Instruct the patient to hold onto the four-pole. D. Place the chair directly behind the bed. Answer. B. Use a gait belt during the transfer. Rationale. A gait belt provides stability and control during transfers. Pulling by the arms can cause injury, and forepoles are not safe supports. Question 24. When assisting a patient with partial hearing loss, Which communication strategy is most effective? A. Speak loudly and slowly. B. Turn off the lights to reduce distractions. C. Face the patient directly while speaking clearly. D. Use complex medical terms to increase understanding. Answer. C. Face the patient directly while speaking clearly. Rationale. Facing the patient allows for lip reading and enhances clarity. Loud speech may distort sound. Medical jargon confuses rather than helps. Question 25. What is the most appropriate nursing response to a patient who is anxious about an upcoming procedure? A. Tell the patient not to worry. B. Ignore the concern to avoid escalating it. C. Offer to call the physician. D. Acknowledge the patient's concerns and provide information. Answer. D. Acknowledge the patient's concerns and provide information. Rationale. Addressing fears with empathy and education reduces anxiety. Dismissing or ignoring emotions is not therapeutic. Question 26. Which finding indicates a need for further education on cane use? A. The patient holds the cane on the stronger side. B. The cane is moved forward with the weaker leg. C. The patient uses the cane for balance and support. D. The cane is held on the same side as the weak leg. Answer. D. The cane is held on the same side as the weak leg. Rationale. The cane should be held on the stronger side to support the weaker leg during ambulation. Holding it on the weak side offers poor support. Question 27. What is the nurse's best response when a patient questions a new medication they have not taken before? A. Your doctor prescribed it, so it must be safe. B. Let me double-check the order and explain the purpose. C. Don't worry, you can trust us. D. You should speak to the pharmacy about this. Answer. B. Let me double-check the order and explain the purpose. Rationale. Verifying the order and providing education demonstrates safety, accountability, and respect for patient autonomy. Question 28. A patient is on a clear liquid diet. Which item is appropriate for the nurse to offer? A. Ice cream. B. Chicken broth. C. Cream soup. D. Milkshake. Answer. B. Chicken broth. Rationale. Chicken broth is part of a clear liquid diet. The other options contain milk or fat and are not allowed. Question 29. What is the most effective method to verify NG tube placement before feeding? A. Check the patient's ability to speak. B. Listen for air sounds in the abdomen. C. Measure the length of exposed tube. D. Aspirate stomach contents and check pH. Answer. D. Aspirate stomach contents and check pH. Rationale. Gastric aspirate with acidic pH confirms placement. Air auscultation is outdated and less reliable. Question 30. A nurse is assigned to 4 patients. Which should be seen first? A. A diabetic patient requesting a snack. B. A patient complaining of pain 4/10. C. A post-op patient with 200 milliliters blood in the drain. D. A stable patient requesting a shower. Answer. C. A post-op patient with 200 milliliters blood in the drain. Rationale. Excessive post-op drainage may indicate hemorrhage. It's a priority over stable or less urgent issues. Question 31. What is the first step in the nursing process? A. Planning. B. Evaluation. C. Assessment. D. Implementation. Answer. C. Assessment. Rationale. The nursing process begins with data collection assessment, which guides all further steps. Planning and implementation follow assessment. Question 32. Which action best promotes independence in a patient recovering from a stroke? A. Completing all tasks for the patient. B. Encouraging the patient to attempt self-care with supervision. C. Discouraging use of assistive devices. D. Limiting activity to prevent fatigue. Answer. B. Encouraging the patient to attempt self-care with supervision. Rationale. Encouraging supervised self-care fosters independence and rehabilitation. Doing everything or limiting too much reduces progress. Question 33. A patient receiving 4 fluids develops swelling and coolness at the site. What is the nurse's priority action? A. Slow the infusion rate. B. Apply a warm compress. C. Discontinue the 4 immediately. D. Elevate the arm and continue infusion. Answer. C. Discontinue the 4 immediately. Rationale. These are signs of infiltration. The 4 must be stopped to prevent tissue damage. Continuing or slowing it worsens the problem. Question 34. When feeding a patient with right-sided hemiplegia, which action supports safe swallowing? A. Place food on the right side of the mouth. B. Use a straw for all liquids. C. Feed while the patient is lying down. D. Place food on the left side of the mouth. Answer. D. Place food on the left side of the mouth. Rationale. Hemiplegia affects muscle control. Placing food on the unaffected side helps ensure safe swallowing. Question 35. What is the priority nursing intervention during a fire in a hospital unit? A. Call the fire department. B. Rescue patients in immediate danger. C. Activate the fire alarm. D. Close all doors and windows. Answer. B. Rescue patients in immediate danger. Rationale. Follow the RACE acronym: rescue, alarm, confine, extinguish. Life safety comes first before alarms or containment. Question 36. How should a nurse correctly measure output in a patient with a Foley catheter? A. Estimate the amount in the bag. B. Record output once every shift. C. Empty the bag into a graduated container. D. Weigh the collection bag. Answer. C. Empty the bag into a graduated container. Rationale. Measuring with a graduated container provides accurate data. Estimating or weighing is imprecise. Question 37. What is the nurse's best response to a patient refusing a bed bath? A. You have no choice in the matter. B. We'll do it later when you're ready. C. You must have one daily for safety. D. If you don't want one, your doctor will be angry. Answer. B. We'll do it later when you're ready. Rationale. Respecting patient autonomy builds trust. Forcing care or using threats is unethical and ineffective. Question 38. What is a priority intervention to prevent constipation in an older adult? A. Encourage bed rest. B. Limit fluid intake. C. Increase dietary fiber and fluids. D. Administer daily laxatives. Answer. C. Increase dietary fiber and fluids. Rationale. Fiber and fluids promote healthy bowel movements. Bed rest and limited fluids worsen constipation. Question 39. What should the nurse do immediately after removing contaminated gloves? A. Dispose of gloves in the trash can. B. Wash hands with soap and water. C. Apply lotion to prevent dryness. D. Put on a new pair of gloves. Answer. B. Wash hands with soap and water. Rationale. Hand hygiene is essential after glove removal to prevent cross-contamination. Question 40. What is the nurse's role during informed consent? A. Explain the risks and benefits of surgery. B. Witness the patient's signature and verify understanding. C. Obtain the physician's signature. D. Sign the consent form for the patient. Answer. B. Witness the patient's signature and verify understanding. Rationale. Nurses do not explain procedures, but ensure the patient signs voluntarily and understands the information. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.